Have you even seen your potential? Have you tapped into your potential? And if you think you feel good now, then wait till you feel the difference between what eating well, hydrating well, and sleeping well looks like. It's critical that you get the right amount of water intake to make it easier for your heart to pump blood to your organs and keep your tissue alive. It plays a large role, not just on your cardiovascular health, your organ health, and everything else. It's shocking how little exercise people do. The individuals with the best blood scores and the healthiest organs were the ones that didn't go to the gym for an intense session 1 hour a day and then were sedentary, but instead they were moving all day, every day. That just tells you how important it is for our organ health to actually move and partake in anything that involves physical activity. So find something that you enjoy, something that you can sustain and stick to. And once you raise the bar, you want to keep it there. Welcome to the Diet Doctor podcast, where we discuss the science of nutrition and high performance, offering practical tools for everyday life. Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah, assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to another episode of the Diet Doctor podcast. Now, for this particular episode, I don't have a guest with me. My guest will be my electronic gadgets here, of which I am very handicapped whilst using. However, what I wanted to do for this episode is run through the process of what a consultation looks like. I'm not trying to sell you a consultation, but just trying to teach you the infrastructure that's involved around creating an eating plan that is customized for yourself, and then what that eating plan will then look like. Now, in the beginning of my forms, other than the personal information like your names and date of birth and everything else and contact details, I do ask the individual for the weight and the height, not because I'm interested in body mass index. Actually, I'll tell you a little interesting story about body mass index. I think it was roughly about year 2000, and I was towards the end of my secondary education degree. And we did a subject called coaching school sport. And I remember it was quite intimidating because there was about 300 people in this lecture theatre. It was a common subject that everybody had to do. And I usually sit right at the back and try and go by unnoticed. The lecturer asked me to come forward. It was summer, was wearing a tank at the time. And he said, I want to teach you why never to use body mass index ever again with children. And because of the formulation involving just height and weight, it often calculates your muscle mass and your body fat as one. So when they calculated the body mass index for myself, I came back to be not just overweight, but obese, morbidly obese. And I wasn't at the time. I just had it, and I was probably a little bit heavy for my skeletal structure, but body composition was relatively healthy. Now, they were teaching us that when you're speaking to kids about body mass index, whether you're covering for a PDHP teacher or you're coaching a particular school sport, try and avoid it, because some kids are naturally more muscular and more dense than others, so avoid it. I avoid body mass index when I'm creating an eating plan. One of the things that I look at, or a heavy component of the consultation and creating an eating plan for yourself, it has quite a significant psychological element, because the biography of the individual tells us a lot about whether that person is going to succeed with X eating plan or with Y eating plan. And that's because the individual and every individual has a different like and dislike for foods. Every individual starts their day and ends their day differently. Every individual has a different form of caloric expenditure for their work. So all of these variables, the biography that comprises the individual, are very, very important to take into consideration when creating an eating plan. This is not just for the experts that are creating the plans for you, but also for yourself. If you're doing this yourself and you're not seeing a professional, not everyone can afford to go and seek the health advice from a qualified nutritionist, but rather have a series of conversations with their trainer and do some digging and some homework on their own and try and experiment with different methods and methodologies. Now, one of the questions I ask is, why are you seeking nutritional counseling? Because if the reason is quite superficial, we try and create a meaning to it, like something that's a little bit more in depth. So, okay, you want to look good, but do you really know what it's like to feel good? Are you operating at your optimal capacity? Have you even seen your potential? Have you tapped into your potential? And if you think you feel good now, then wait till you feel the difference between what eating well, hydrating well, and sleeping well looks like. Because once you're exposed to a different level of homeostasis, a different benchmark, it's very hard to get back from that. And once you raise the bar, you want to keep it there. The other one is, have you sought diet advice in the past? Because often people haven't, and they've just experimented with a lot of different ideologies themselves. It's actually a lot more difficult for me to help somebody who was once thin, became overweight, and now is trying to lose weight. That's a lot easier to deal with than the individual that has yo-yoed, for a decade or so. And there are many of them. There are many individuals where their weight has fluctuated by over 5 kilograms every 3 to 6 months for up to a decade. And one thing I tell people that yo-yo diet, because it causes what's called metabolic syndrome, making it very, very difficult to lose weight. One thing that I tell these individuals is that, did you know that every 5 kilos of weight fluctuation, although you may feel like you've accommodated to it within, a couple of weeks, it takes up to 12 months for your organs to adapt to the change. I'll say that again. Let's say, hypothetically speaking, you weigh 80 kilos and you go to 85. For the first week or two, you're going to feel different. Going up that flight of stairs is going to be a little bit more strenuous, a little bit more difficult. However, you adapt. You feel like you've adapted. 2 weeks later, you're like, you know what? I feel like this new 5 kilos is part of me. I don't feel it when I'm doing my jiu-jitsu. I don't feel it when I'm doing my cardio. I don't really feel it much when I'm doing my weights anymore. Initially I did, but that feeling of, being out of breath a little bit sooner has started to subside. That is the superficial effect of weight gain, and this is even weight loss included. Your organs have to change the way they operate to accommodate to a different amount of tissue, because now you as an individual and your organs, keep in mind your organs are responsible for sustaining life. So your organs have to do, let's say, 10% extra work or 5% extra work. The amount of work that is required on behalf of the organs is now larger, especially the heart. And that can take up to 12 months to adapt for a 5 kilo discrepancy. So that's a very, very critical question. I always ask, has your weight fluctuated by more than 5 kilos in the last 12 months? And was it a gain or a loss? Health-related conditions, one of the most, or the thing that pops up the most, and this is what people are conscious of just by a basic blood test. And I want to do a segment where I just basically break down blood test results, but hormone level, sports level blood tests, not a GP blood test. With all due respect, the GP blood test is very good and it's very, very essential at determining your health, your organ health, kidney function, liver function, your risk of cardiovascular disease. These are all critical things to look at. However, not many people know that there are advanced levels of blood work that you can go and get if you pay for them yourself without even seeing a specialist. If you ask the GP for a hormone blood test, they're going to send you to an endocrinologist. If you tell them about your gut issues, gastroenterologist, and so on and so forth. Because the variables that you can test in a blood test are vast. There could be 1,000 variables to test for, and blood tests can cost $100 paid for privately, and they can cost as high as $10,000 if you're picking all the variables that exist. Now, blood work can be quite comprehensive. However, even the layman who just, once a blue moon gets a blood test from the GP, unfortunately, 2/3 of the time they come back with either cholesterol issues, type 2 diabetes, or both. These are very, very problematic. And although they are very easy to fix, they are very scary, scary conditions that you have to, take on head on. Otherwise, you can regress from a health perspective quite quickly. I've got friends that have had toes severed, had to be amputated because of type 2 diabetes. Vision is severely impaired because blood sugar regulates vision. They've had strokes and things like that from high C-reactive protein scores and bad cholesterol scores and all the rest of it. Although they are very, very easy to fix if you apply effort with your nutrition and your diet. I'll tell you a little story. One of my closest friends, his mother-in-law was diagnosed with early stages of cancer. This was almost 15 years ago. She's still with us today. Now, the doctors wanted to remove, I'm not going to mention the hospital, but the doctors wanted to remove the tumor because it was a small tumor, very easy to get rid of, provided that she's able to be subjected to the surgery. Now, she was not allowed to be subjected to the surgery because no anesthesiologist would touch her. Her blood sugar was 17. And the anesthesiologist is scared that if you put someone under with a blood sugar of 17, that they may slip into a coma. So they gave us some homework, and the diet that it consisted of was sort of burning the candle at both ends. It was treating the symptom, not the cause, which I hate, spiking insulin levels, regulating it with medications like Diabex or even insulin. Now, her blood sugar had to be below 10 in order for the anesthesiologist to get involved and for this surgeon to operate and get the tumor out. I gave her an eating plan initially and she did not follow it. Stubborn old Italian woman, wouldn't do it. And then I advised her daughter, I said, stay with your mother, make sure that she consumes all the food. The first concern was, but there's a lot of carbohydrates. I'm like, yeah, okay, they're low GI carbohydrates. And I've strategically placed foods together, combined foods, used food combinations to make sure that if there is a potential insulin spike, that it is suppressed using, some good fats. And there was a lot of thought that went into the meal plan. On Monday, she executed the meal plan. Monday. Tuesday, she followed it again. Wednesday, she had a routine checkup. Now, that was a routine checkup, not anything that was booked in or predetermined to be executed. On that routine checkup, as per usual, prick the finger, check the blood sugar levels. The blood sugar levels on Wednesday came back at 7 instead of 17. That was cleaning up the diet, going for a stroll every day. Very basic things that we tend to neglect. Now, when they saw the blood sugar levels at 7, the doctor quickly contacted the anesthesiologist and said, can you please come in for an emergency surgery? He did, and that same day she was under the knife and had the tumor removed and was in recovery by the end of the day on Wednesday. Thursday, again, recovery. Friday, health checkup and checked out of the hospital. Like I said, that was about roughly 15 years ago. She's still with us today. So on the journey of Monday to Friday, type 2 diabetes was gone. Early stages of cancer were removed surgically because the blood sugar was low enough for her to be operated on. So you can see how something we think is insignificant because it's just a word that's thrown around so nonchalantly, diabetes, cholesterol, everyone's got it. This was preventing her from getting rid of a tumor that could have progressed and potentially taken her life. And the fact that it was sorted within a matter of days was nothing short of remarkable. I got a phone call, I remember, from the head of the diabetes department at that hospital thinking that I'm going to cop of ear bashing for getting involved with a patient, but it was actually because she wanted an eating plan herself. So a lot of the information that we have out there, whether you're health professionals or not, I'm not saying that I know more than the next expert. What I do make an effort to do, though, and I encourage every person in every profession to do the same, is stay on top of your research. Stay up to date with your research. If there are new methods and methodologies and ideologies, learn them. Figure out whether they apply to your career, whether they apply to your patients or to your customer base, because All of this is very important, and it'll prevent you from, just being left behind as your field starts to make progress, and things, especially with technology, things are progressing quite quickly. The other thing, moving on, is regarding exercise. It's shocking how little exercise people do. And exercise doesn't mean getting a gym membership. It merely means just making an effort to do something that you enjoy that involves movement. And also what I find, especially looking at blood tests, and I was looking at a lot of them yesterday for a corporation, blood test after blood test, the individuals that had the best blood tests weren't the ones that trained in the gym for an hour every day intensely or 4 or 5 days a week. Surprising enough, it was the individuals that made an effort to be moving or be active outside of the gym. So I'll say that again. The individuals with the best blood scores and the healthiest organs were the ones that didn't go to the gym for an intense session 1 hour a day and then were sedentary, sitting behind a desk for the remainder of the day. But instead, they were moving all day, every day, or at least even if they had an office job, they would get up and go for a stroll every 20 minutes or so, just for 5 minutes. What that's called is non-energy activity total calories, otherwise known as NEAT. So the people that did that were far healthier. They didn't think that that would be the case because they don't even have a gym membership. However, that just tells you how important it is for our organ health, for what's on the insides, to actually move and partake in anything that involves physical activity. So find something that you enjoy, something that you can sustain and stick to, and do it. Now, the other two that I'll mention very quickly is sleep and hydration. Sleep is so important for regulating your metabolism, particularly the sleep between 11 p.m. and 1 o'clock in the morning. If you're sleeping after 1 o'clock in the morning, it doesn't matter if you get 8 hours sleep or not, you're going to wake up tired. And that's a fact. And many of us have experienced this. We go to sleep late, we wake up and we feel like we haven't slept and we need another 10 hours. That's because the amount of deep sleep or REM sleep, rapid eye movement, you achieve does not hit the quota. And you need about 15% of your sleep to be deep sleep and roughly 20 to 25% to be REM sleep. You don't need much, just an hour or two of each will suffice. However, it's very difficult to get that if you don't get to bed before 11 o'clock in the evening. And when I used to work in metabolic clinics, and I used to look after and work within 14 different metabolic clinics before COVID, and without fail, every individual with metabolic syndrome and obesity and weight issues, they all slept poorly. The other thing that they did quite poorly was hydration. A lot of people think that, and I hate it when I say, how much water do you drink? And they say a lot. A lot means maybe a 600 ml bottle of water, sometimes 2. And that's not a lot of water at all. The individual should be drinking 30 milliliters of water per kilogram of body weight. And every time you train, the water that you drink during training, and you should be drinking water whilst training, does not count. For example, if the individual weighs 80 kilograms and that individual times 30 is required to drink 2.4 liters, and there's 40 minutes of exercise involved, that's a minimum of half a liter of water that you have to add on top. So now we're up to 2.9 liters. If I have 2 coffees a day, or 1 coffee, 1 black tea, because black tea is also caffeinated and is a diuretic, you have to add at least 100, 150 mils of water for every shot of caffeine that you have, and that also doesn't count to your water intake. So now if I have 2 coffees, we're up to about 3.1 liters per day. It's critical that you get the right amount of water intake to make it easier for your heart to pump blood to your organs and keep your tissue alive. And you'll notice that it plays a large role, not just on your cardiovascular health, your organ health and everything else, but your energy levels. Water is, because your cells communicate with water via water, electricity, but also water. So you'll feel better. Your clarity, mental clarity is better. Your likelihood of getting headaches and migraines is reduced. Your gut health is better because when you're dehydrated, by default, you're bloated and constipated. So these things play a significant role in how you, not just how you look, but also how you feel. That's a brief summary of what is involved in a consultation and the reason behind why I ask these questions. So whether you're seeing a professional or not, ask yourself these questions. And only when you can truly answer them will you be able to create an eating plan or a methodology of approach towards food, a healthy relationship towards food, not a relationship that's, uses food as either a form of reward or punishment, but a relationship with food that you can sustain that is healthy. And I wish you all the best with that. And I urge you to stay tuned for the next couple of episodes that will involve breaking down what a day of eating looks like on average for a healthy individual, as well as what to look out for some blood markers in your blood tests. Thank you for listening, and I'll see you again soon. Assalamu alaikum.